Hi, this is Tim and Jeanette on the ICU, and we are talking about a really important subject today, hand hygiene. Everybody's favorite, right?
Yeah.
It's not only important for patient safety, but the Joint Commission, when they do their tracers, they're really looking at our procedure for washing our hands, how often we do it, when we do it, and we need to really get the word out to staff, just as a reminder how important these touch points are. Me and you talked for a minute about the World Health Organization's 5 moments of hand hygiene, which I think was a really good model as just kind of something to trigger the idea or the notion of hand washing in your head. And I was just wondering, as a clinician, from your perspective, how you could use something like the 5 moments of hand hygiene in your own practice and ancillary staff and such.
Yeah. So hand hygiene is one of the most important things that I can do to help keep our veterans safe, not only between nursing staff and ancillary staff, combined with our efforts. When we go into a patient room, it's important to use hand hygiene, whether you're using hand sanitizer or washing your hands in the sink. It's important to, especially in the intensive care unit, we do a lot of sterile technique procedures, and so it's critical to wash our hands before that so we don't start a central bloodstream infection. For our aides, they're great at washing their hands before they go and pick up trays and bring it into patient rooms, and then using hand hygiene after leaving the room. Basically, anytime before or after I'm touching a patient, I am using hand hygiene, not only with gloves, but also without gloves. If I am putting gloves on, I'm using hand hygiene afterwards. So it's really important. It helps keep our veterans safe. Housekeeping, I know that they do a great job, like when they're changing out curtains, to use hand hygiene afterwards, so we're not spreading any extra bacteria to our veterans who need it.
Jeanette, that's really good. You hit on a couple real key points. And when I thought about this, you're really in a perpetual hand washing situation during your daily shift.
True.
When I'm putting on my gloves, I'm doing hand hygiene just before. When I take off the gloves, I'm doing hand hygiene. If I'm fluffing a pillow and then going on to another activity, I'm actually washing my hands.
Yeah.
So more times than not, we're literally washing our hands just dozens and dozens of times during a shift.
Yes.
That was excellent. I appreciate you joining us today.
You're welcome.
That's Tim and Jeanette with your Joint Commission Tip of the Week. Now we have to wash our hands.
Oh, wash your hands.